When you're taking a patient's temperature, always make sure to wash your hands first and follow standard precautions. In my case, I already did wash my hands. Then you have to introduce yourself to the patient. I am Novi Antiporta, the medical office assistant of Bow Valley Medical Center. And now, Mr. De La Cruz, I'm going to check your body temperature. And I'll let you sit in your most comfortable position.
Thank you.
Okay. Okay, Mr. De La Cruz, have you had hot or cold drinks during the past half hour?
No, I have not.
As well as smoking?
Nope.
All right, so kindly open your mouth.
Mm-hmm.
And I place this under your tongue.
Mm-hmm.
And please don't let the patient close his mouth without placing teeth on the thermometer. Okay, and you have to left in place the thermometer until beep will be heard. And read the results in the digital display window.
Thank you.
Clean the thermometer using disinfectant spray or soap and water before and after use. And then after that, you have to wash your hands and record temperature and patient chart. When taking the radial pulse, position the patient with the wrist resting on his lap. Locate the radial pulse using pads of first 3 fingers. Gently compress the radial artery enough to feel the pulse. For my patient, his pulse rate is regular, and I counted it for 30 seconds and multiplied it by 2. So when you're done taking the radial pulse of patient, you have to wash your hands and record the pulse rate in patient chart. So when you're taking the respiration rate of patients in a clinical setting, the patient should not be aware that you're counting the respiration because it will not provide you with accurate results if patients become aware. So the best thing to do is when you're taking the radial pulse, you should subtly shift your eyes to the patient's chest and abdomen and count the rise and fall of the chest wall for 1 minute. For the purpose of this video, I can also hold the patient's arm and place it across the chest and feel the rise and fall of the chest wall. While counting the respiration, note depth, rhythm, and breath sounds while counting. Before doing the blood pressure, always wash your hands and assemble equipment. Make sure the cuff size is correct. Clean earpiece of stethoscope with alcohol wipe, then introduce yourself to the patient. Now, Mr. De La Cruz, I'm going to take your blood pressure.
Mm-hmm.
Okay? You have to bear the right arm or right upper arm of the patient and make his feet flat on the floor. I have to position the patient so that the brachial artery is at level of the heart and the arm is supported so that there is no additional muscle tension. Palpitate the brachial artery. Securely center the bladder of the cuff over the brachial artery above and bend of the elbow. Locate and palpitate the radial pulse and smoothly inflate the cuff until the pulse is no longer feel. Note the number. Then quickly deflate the cuff and allow the arm to rest for 1 minute. Make sure the cuff is completely deflated. Now position the stethoscope over the brachial artery and held in position with fingers only. Inflate cuff smoothly and quickly. Deflate the cuff and listen to the Korotkov phase 1 and note when it appeared that would be the systolic. Continued deflation, noting the Korotkov phases. Noted when all sounds disappear, that is the Korotkov phase 5. Note that diastolic is the last sound you hear. Then, deflate the cuff quickly. Then, remove cuff and clean earpieces and diaphragm of the stethoscope with alcohol wipes. Wash hands and record the blood pressure in patient chart.